Hello, doctor. I hope all of you are doing well. Um, Sorry, it has been a long time we didn't post new educational videos in our um, channel. However, we will start to regularly doing our Wednesday teaching, free teaching, as well as the frequent educational videos. Um, Today, I want to do this, just rapid discussion regarding if a patient present with a complex um, presentation, okay, if for example bloody diarrhea, okay, so there is blood and there is diarrhea, and I find a lot of doctors that I'm teaching, they have struggling how to analyze such symptoms. So I will just show you how I'm thinking in such cases, and as well as how we can approach them. And there will be also a good example, okay, sounds recording of a good example. I hope that will be helpful for you. So yeah, so that's simple introduction about my qualifications, um, and how I am thinking about bloody diarrhea. So you need first to ascertain what the patient mean by bloody and what does it mean by diarrhea. What does he mean by diarrhea? Don't take it for granted that it's true diarrhea. Okay, so you need to ascertain, is it increase the changes in the frequency or consistency or both, because typically diarrhea means that increase the water content. Okay, increase the water content of the stool either by decreasing absorption or increases secretion. Okay, this is the main mechanism of the diarrhea. And the opposite side, there is something called hyperdefecation, okay, which usually we'll find it in hyperthyroidism, when the patient have normal consistency of stool, but is going more frequent. So that's the most important bit. What does the patient mean by diarrhea? And then coming to the other bit, so what does he mean by blood? What does he mean by bloody diarrhea? Is it all blood? Is it the stool mixed with blood, or is it only blood during wiping his back passages? So, and if it's, all blood or mixed with blood, what type of the blood is? Is it fresh blood or it's a dark blood, digested hemoglobin blood? Okay, because if it's fresh blood, most probably it's from the lower GI or massive upper GI. And in this case, is patient, the massive GI bleeding, upper GI bleeding patient will be hemodynamically stable, and I don't think it will present in the GP land except very rarely. And or it's melena. Melena mean digested blood, so most probably it's coming from the upper GI, or it's just what after wiping. And then if it's after wiping, you need to think, okay, is it painful or painless? So the second step, is it the pain? Okay, because if it's painful, okay, it can be fissure. Is it painless? Can be hemorrhoid. And the opposite side, diarrhea, is coming with simple colic or is coming with an acute abdomen, because that's having a complete differential diagnosis. And then the second step will be the associated symptoms. Okay, for the bleeding, is there any bleeding elsewhere? Okay, the patient bleeding from other sites. So if there is any systemic cause of the bleeding and it just presented as the blood in the stool, okay, or it's just localized in the GIT symptoms cause, okay. And the bleeding symptoms is of two type, either frank, I mean the patient, will say, okay, I have epistaxis, I have gum bleed, or I have even bruises in the skin, or concealed, that you need to, ask the patient about. And the concealed bleeding usually is in the cavity of the brain, so it can be in the intracranial bleed, so the patient will come with hemorrhagic stroke or even headache, blurred vision, or in the thorax, okay, or in the tummy, and that's need, to be, questioning the patient. And the earliest sign of concealed bleeding in the chest or the abdomen is the orthostatic hypotension. So it might worth asking the patient to come in and ask him to come in to check his vital signs for sure, without doubt, and taking his blood pressure lying and standing. And for the diarrhea, I would always ask about, symptoms of connective tissue disease or autoimmune disease, which, is skin rashes, fever, joint swelling, or, iritis or iridocyclitis, eye symptoms. Then asking about the complication, what might what is the end result of the presentation. So what is the complication of the bloods? Losing blood is anemia or becoming hemodynamically unstable, and for the diarrhea will be, say, dehydration or electrolyte disturbance, namely hypokalemia. Okay, and that will cause cramps in the calf muscles, and eventually because of the dehydration that can lead to acute kidney injury and decrease in the urine output. Okay, all of these won't take from you more than 2 to 3 minutes if you have a good structure and in your mind. Okay, if you have a good structure, you're not thinking what to ask. Okay, already practice it many times, and you listen to the video. That I think will make you more than sufficient to go through all the questioning in less than 2 to 3 minutes. And then we'll come to the timeline. Timeline of diarrhea is very important because we have three types of diarrhea and each type have its own, differential. So if it's acute diarrhea, which means within 2 weeks, or, chronic diarrhea, which means more than a month, or subacute, which is, the interim between the 2 weeks and the month. Coming to the possible differential diagnosis for the acute diarrhea, the main three causes, okay, and then plus, okay, three causes plus, okay, the three, either the ischemic cause of diarrhea, and then the ischemic colitis, the patient will present with pain out of proportion to the clinical symptoms. So the clinically, the patient might be, doesn't have acute abdomen, doesn't have a massive, clinical signs or symptoms, but the pain is out of proportion of the clinical presentation, your findings. Okay, and the important bit in that history, ask about patient about cardiovascular risk. Okay, ask about AF. Okay, because that's crucial. Most of the cases I saw them with ischemic colitis, they have an AF, and then an embolus will go from the heart to the mesenteric arteries and will cause the ischemic colitis. Infectious, well, if it's food poisoning, that will come with more than one case, okay, more than one case at the same sitting, or just, or the patient is dealing with animals, okay, especially the patient that dealing with, cows and and the Campylobacter jejuni, which is very common in the UK. So, and the complication of the Campylobacter, which Guillain-Barré. So all of that need to be in your mind, because if you have time, you might ask about also any neurological symptoms that the patient have, and then be aware about the traveler diarrhea and history of traveling, and the complication of hemolytic uremic syndrome, specifically with the enterotoxigenic, salmonella or shigella or E. coli variant. And the other thing is for sure the inflammatory type, which is either IBD, or either definite IBD like ulcerative colitis, Crohn's, or microscopic colitis, plus undetermined colitis, which is very common. Okay, and what is the plus? The plus either can be early presentation of chronic diarrhea or overfeeding diarrhea. So patient that is eating a lot, or binge eating, and then they have diarrhea, or using laxative, to avoid the excessive weight gain. And here in this simple A4 is all the differential diagnosis and the treatment and the red flags, because for sure you need to ask about the red flag of cancer, like unintentional weight loss, or night sweats, or any lumps or bumps, or difficulty in swallowing, and massive bleeding in the stool. For the chronic diarrhea, always remember IBD, IBS, celiac disease, okay, and for sure the microscopic colitis as an IBD form, and hyperthyroidism. Don't forget hyperthyroidism, because hyperthyroidism will present with hyperdefecation. Okay, see, these are the main, differential that usually running in my mind when I meet a patient with a chronic diarrhea. Very rarely, I met it maybe 3 or 4 times in my career until now, that the neuroendocrine tumors like carcinoid or Zelinger-Ellison and carcinoid syndrome, but just key also that you need to be kept in mind, but is rare, okay, but not that rare. I met 3 or 4 cases during my career. And here how to approach, general approach the diarrhea. You can go through them, and then it's very comprehensive summary. And then what I needed from this slide is how we can deal with the elevated serum protectin. Okay, how to deal with it. Is more than 250 that usual, and there is a clinical symptoms. Okay, and but not improving. The usual you need urgent gastroenterology for colonoscopy, and then maybe a biopsy, and then to determine if the patient have IBD. And then if it's less than 250, namely between 100 and 200 to be repeated, and then according to the level you will act. And then if it's less than 100, less likely to be IBD, probably IBS. But there is also age criteria. So if the patient less than 50, that's mean most probably IBS. Okay, and if it's more than 50, or still there is clinical suspicion, can be IBD, especially if the patient are having non-steroidal or PPI, or all of this associated with microscopic colitis. So you can refer routinely to the gastroenterology. So this is the main differential between the ulcerative colitis Crohn's and microscopic colitis, and the medication. You can find that most of them are medication that half of our patient on, okay, which is aspirin, PPI, non-steroidal, selective serotonin, and statins. So keep in mind microscopic colitis always, please, okay, because it's tricky. It's tricky to diagnose. It all depend on your clinical suspicion. Here is the fit test, and we'll have for sure, all of these diseases will have this, we'll have them in details. Discussion is just this time is rapid wrap up, but we will talk about, colon cancer, talk about IBD and how to deal it, and what is the use of the what is the job of the IBD nurses, and how to treat, and then what is the budesonide enema, what is the sulfasalazine, how to use it, and the doses, okay, and how to deal with the flare up of IBD. Okay, all of that will discuss, as well as IBS, how to treat and how to diagnose. And just I need here to be aware about the fit test, and then what is the difference between the screening fit test and the and the diagnostic fit test that we are doing in the clinic. So the screening fit test, usually the cutoff is much higher because it's screening. Okay, there is no positive data, no positive clinical symptoms. Okay, but in the fit test that we are doing, the cutoff is less, which is 10. Okay, 10. That's because we have the pretest probability is more in the case of fit test for diagnosis in the clinic, okay, rather than the screening. So the screening, the pretest probability is low. That's why the cutoff is higher, but the pretest probability for the diagnosis is usually on lower, because we have high pretest probability. Now we will listen to the case, but just a gentle reminder about the available resources, that the SCA Level Up YouTube channel, and also the WhatsApp and Telegram groups. And if you need any help or support, further help and support, I'm doing one-to-one teaching, hourly rate or mini mocks, and then soon also we will conduct comprehensive courses, okay, and video courses as well. Okay, so if you are interested in any of these, please contact me, and I will try to help as much as I can. Okay, so let's listen to the recording. Okay. So this Dr. Bailey is meeting with Mr. Smith, okay, who's presenting with a bloody diarrhea and have some test, okay, and he's discussing with him what is the possible causes, and please concentrate how the doctor analyze the intake, the alcohol intake with the patient very sensitively, how the doctor analyze or ask about HIV infection as one of the differential diagnoses in a way that cannot, in a way not insulting, ask in a way not insulting to the patient, okay, as well as He asked about the connective tissue disease, okay, and what are the other possible diagnoses in very calm, sensitive, and comprehensive history taking, to be honest, is a very good example. And here will be the script, just if you would like to read.
Oh, hi. Pleased to meet you. Is it Mr. Smith?
It's Mr. Smith, yes, John Smith.
Oh, pleased to meet you, Mr. Smith. I'm Dr. Bailey.
Hi.
Just describe, kind of in your own words, what the problem's been and why you're here.
Well, I mean, basically the problem is diarrhoea, actually, which has just been building up. It's, it's been going on for quite a few months, and then I sort of had a little period where it sort of settled. But last couple of months, it's really, built up quite, to quite a large scale, really. And, it's draining me in every sense of the word.
I'm just going to take some notes, if that's
Sure,
okay,
sure. Yeah,
as we're going along, just so I don't forget things. So you said diarrhoea.
Yes.
Yeah. Just tell me a bit more about that.
Well, I mean, I'm going much more frequently. Very, very loose. I would certainly call it diarrhoea, and there's quite large quantities. Showing blood, but I'm quite concerned about that. And, I've lost a bit of weight and things.
So very loose. I mean, when you say very loose diarrhoea, do you mean like water?
Pretty well close to there, yes.
Really?
Yes,
Okay.
pretty well.
Quite watery.
Yes, I would say watery.
And tell me about how how long you've noticed the blood and how bad is the blood?
Well, I mean, the blood I only noticed over the last couple of months.
Okay.
I did have episode earlier, but it wasn't quite as loose, and there was certainly no blood that I noticed. And I wasn't going as frequently either. This was about 8 months ago. The last couple of months, as I say, I'm going more frequently. A fair amount of blood. I obviously can't really quantify it at all, but it is generally noticeable. So I would say there's a reasonable amount.
Reasonable amount. And is
significant.
A significant amount, yeah. And is this blood that's kind of maybe mixed in with the diarrhea? Or
by and large, no, it's by and large mixed in,
mixed
yes.
in. So it's not just when you wipe yourself you notice the blood?
No, I actually notice it mixed in, and I find sometimes that I'm sort of having to strain, I mean, I still feel I want to go, and sometimes I'm just getting, some blood coming and sort of gungy stuff.
Okay. Like mucus, you mean? Or
I suppose you'd call it that, yes,
right,
yeah.
Gungy. Okay.
Yeah.
And you said that you're going often?
Oh, yes, yeah, sure.
Yeah. How often? What?
Up to 6 times a day or so,
Really? So quite, yeah. As much as that.
Which, yeah.
Do you go through the night at all? Once you're asleep?
Generally I do, yes, generally.
You do?
Just occasionally it gets me up, but generally at night I'm okay.
Okay, but sometimes it does.
Yeah.
Okay. Any pain associated either before you go to the toilet, after, or?
No, not really, no.
So no tummy pains at all?
It feels a little bit sore, obviously, I think, with going, but I wouldn't call it pain.
Okay. So
Yeah.
no abdominal pain. You mentioned weight loss.
Yeah.
Is that, could you put a figure to it over over a period of time, or?
No, I don't think I can. It's more noticing the, maybe half a stone, but that's guesswork, really, to be quite honest.
And if you look back, when I think you mentioned initially it started, and obviously the last couple of months it's been a lot worse.
Yeah.
How long are we thinking that this has possibly been a problem?
About 8 months it first had the problem, but as I say, it was nothing like as severe.
Yeah.
Yeah.
Worse over the last couple of months.
No.
Have you ever had this before these last 8 months?
No.
Never in the past? Never had any bowel problems?
No.
Are there any family history of any problems with the bowels?
No, not at all, no. Well, not as anybody's ever mentioned, anyhow.
And other than the bowels, are there any other sort of new symptoms that you've noticed over the last few months?
No, I don't think so. It largely revolves around that.
Yeah. How's your appetite?
Well, it's probably gone off a bit. But I think, you know, when you sort of go into the loo every 5 minutes or so, it seems, sort of puts you off a little bit, yeah.
I mean, do you think the diarrhoea is associated with eating, or does it come even if you don't eat anything?
Oh, I think it comes even if you don't eat anything, yes.
So there's no real association?
I don't
with
think
food?
so, no, I don't think so.
Okay. That's my other question. When you go to the toilet and you have a motion in the toilet, is there any difficulty flushing it away? Or does it, you know, is there any...
Flush is okay, actually.
Yeah,
yes, it flushes okay. No, it's not a problem.
Just a few other questions about various aspects. Any problems with your joints?
No. You mean stiffness? And,
and
so no.
And any rashes at all on your skin?
No, nothing I noticed.
Any problems with your eyes?
No, those are fine.
Good. Any problems with feeling hot or cold or anything that might suggest infection?
No.
And you certainly not had any fevers then?
No.
Any sweats?
Sweats? No.
We've mentioned your weight. Any travel, either recently or in the last few years?
No, nothing at all, you know.
And can I ask where you were born?
Where was I born? Oh, in the UK, Manchester.
And the last time you travelled outside the UK?
Oh, a few years ago actually, and that was only going to France, so, you know, about 5 years ago I think. Nothing recent at all.
And are you married, can I ask?
Yes, I am.
Any children?
No.
No children. And do you smoke?
I packed in some years ago.
How many years have you not smoked for?
It was about, I started a little bit after school and packed in a few years after that, so I think it was a good 10 years.
And how old are you, can I ask? Sorry, is it
35.
35, yeah. And so you stopped smoking, say, about 10 years ago.
Yeah.
How old are you when you started smoking, roughly?
About 20 something like that. Yeah, about 20, not earlier, certainly.
And how many a day, roughly, on average?
More than 10.
Alcohol-wise, do you drink at all?
Just the occasional social drink, yeah.
Would that, when you say occasional, would that be once a week, once a month?
Maybe a couple of times a week,
And how much would you drink then on an average week?
I don't know. Bottle of wine maximum or something like that, you know, you're thinking units, don't you? I wouldn't have thought it would be over 10 units.
Are you working?
Yes, I'm a musician.
Which instrument do you play?
A saxophone.
Do you play it to a sort of a high level, or?
I'd like to think so, but I'm sort of freelance with various orchestras and things and groups, and you know, you get the work as it comes.
Yeah. Good. And you said you're married. Do you take any medications at the moment?
No.
Do you take anything over the counter? No. So you've not actually taken any sort of anti-diarrheal agents or anything like that?
No.
Are you allergic to any medications?
Nothing I know of, no.
We said that obviously you've not smoked for a long time. Do you take any other recreational drugs at all?
No, I don't. I know what you're thinking, musicians and things, but there is quite a bit of that going on, but no, not me.
Another few sort of kind of personal questions. Have you ever had a HIV test ever in the past?
I haven't. No, I haven't.
No. Have you ever felt the need to have one?
No, I have not.
No.
I have not. No,
Okay.
I'm not into that sort of scene.
And you certainly, you said you're married.
Yes, that's right.
And you've never used recreational drugs, never injected drugs.
Oh no.
And from have you ever had any blood transfusions in the past?
No, I haven't.
Never. Okay. So and you're heterosexual.
Oh yes. Oh yes.
Okay.
Yes.
Anything else happened in the past at all? Just to get away from this, in the back, in the past, have you been to hospital for any reason? Had any illnesses?
No, nothing.
Nothing. Any operations?
No, never an operation.
No. And we mentioned about your family history. A few other very quick questions, just to kind of see if there's anything else we've missed. Do you ever get breathless?
No.
No. Have you got a cough?
No.
Any problems with your heart?
Nothing I know of. No, I don't feel it or.
No palpitations when your heart goes very fast or anything like that. No chest pains.
No.
Nothing like that. Do your ankles swell up at all?
Not noticed. No.
Do you ever get headaches?
No. Or very, very rarely, very rarely.
Just the occasional one?
Yeah.
Any problems with the eyes?
No, those are fine. Tested recently, actually.
Good. Okay, I think that's probably most things. Is there any questions that I should have asked that you think I need to know about?
No, I mean, I don't know. I mean, whatever you think this might be, I mean, well, as I say, the doctor seemed to think it could be potentially a serious scenario,
Yeah.
so,
I mean, what I was going to do, if it's okay with you, just summarise it quickly, just
yeah,
to see if I have got all the points and
sure.
sort of fill me in if I miss anything out. So you're obviously 35.
Hmm.
You've had a problem with your bowels mainly for about 8 months.
Yeah, yeah, oh yes.
Worse over the last couple of
Our last
months.
couple of months.
And now you're going sort of up to 6 times a day,
Oh
so
yeah, yeah.
very loose,
Yeah, yeah.
with associated blood. Is it bright red blood? Can you see it?
It can actually be bright and it can be dark.
Okay, so a little
So
bit.
it can be both, yeah,
little
yeah.
mixture. And you've lost probably about half a stone in weight over this time.
That's guesswork, admittedly, but I have
Yeah.
lost weight, yeah.
Okay, and like you say, going up to 6 times a day. And I think probably what we need to do. So, have you any ideas yourself? I mean, you said potentially serious. Have you got any other ideas?
Well, I don't know. I mean, there's blood tests that were done, and I'm partly wondering, you were asking about HIV and things. And I wondered whether you were sort of thinking of any link there, but I can't think why it would be at all, because
No.
like I said, I have given you straight answers there.
Yeah, yeah.
But in that case, I can't really think.
Yeah, okay. I mean, I think that's just, I was just thinking kind of outside the box and just thinking of everything that is a possibility. But from your own point of view, you've never felt the need to have a HIV test, or don't think you're at risk of HIV.
No, I would have said not.
So
No.
I think that's very unlikely.
Yeah, yeah.
Your blood test already is low, so that means you're anemic. I don't know if he told you that or you were aware of that.
Not really, no, anemic, right. Could that cause this problem?
Well, it certainly could be a consequence of this problem, definitely. Yeah,
right, okay.
because the
So
fact
it's
that you're
not a
losing
cause.
blood
Yeah.
can make you anemic, definitely. They've also suggested that the anemia is due, or there's a strong suggestion that anemia is due to blood loss, just because of the type of anemia that it is.
So
It looks as if it's because of lack of iron, and that's what happens when you lose blood, you lose iron. So it looks like that. I think certainly we need some investigations to try and get to the bottom of it.
Sure.
I think we will get to the bottom of it,
Yeah.
and hopefully there will be treatments available.
Yes.
What I was proposing from the clinic today is to examine you,
Right.
then do some blood tests,
Yeah.
and then probably to do a what we call a colonoscopy,
Right.
where we look inside the bowel, and that will tell us what the bowel looks like, and is there any reason for this diarrhea that you've been having and the blood loss.
Right. Is this one of these camera tests?
Yeah, so it's a camera test.
Yeah. Okay.
What I would want to ask you as well, when we do the blood test, just to go back,
Yeah.
is your permission to do a HIV test? Because I think that's something that we do routinely.
Yeah.
Yeah.
Yeah. But no, as I say, I'm sure you won't find anything.
No, but you'd be happy for
Well, I
me to-
trust you won't. I can't think of any reason why you would. So yeah, no, if you want to, if that's routine, then yeah.
Thank you. And the other question was, we'll probably, if we can, try and get a sample of your motion, just to make sure there's no infection or anything
arrange
like that. Yeah, that shouldn't be a problem.
No problem.
Excellent. Any questions? I mean, I can go into the details of the colonoscopy if you want me to.
No, that's okay. That's
Yeah.
okay. I'll deal with that when it comes. I mean, that won't be immediate, will it? There'll be a little delay, won't it?
Yeah, well, it's done pretty quickly.
Okay.
Because this
Okay.
it sounds quite serious. If you're going, if you're going 6 times a day and there's blood in it.
Well, I'm certainly fed up with it all. And
Yeah.
yes, I mean, blood is not a good sign. And obviously, you say it's causing anemia and everything, which is not going to do me much good, is it? So, yeah.
No, I think we certainly need to do things
Yeah.
quickly and hopefully try and get it
Yeah.
under control as quickly as we
Oh,
can.
yes, please.
Okay.
Yeah.
So I'll arrange that.
Okay, well, thank you, Doctor.
Okay. Thank you very much.
Thank you.
Okay, I think is very good example. Okay, it's just for the completion. Okay, don't hesitate to do a fit test with the patient having blood diarrhea. Okay, because just your instruction, tell the patient please try to use to get us a sample that is not full of blood. Okay, but still is valid and is valuable in these cases. The other thing, if it's female and having, bloating, early satiety, please don't hesitate to do CA125 to exclude ovarian cancers. Okay, and also one of the differential kept in your mind, TP and enterocolitis, especially if the patient coming from overseas or doesn't have history of BCG vaccine. That's an important. For the completion, please listen to the other recording regarding the C. diff. Okay, regarding the C. diff, that's very important. Okay, so just for the completion of the diarrheal illness in adults, and keep in mind that you can use diarrhea. Okay, and the other video discussed when we should use the antibiotic and when we should use the antidiarrheal medications. Okay, see you on Wednesday where we'll start the our teaching again. Okay, on Wednesday, and we'll discuss abdominal pain or tummy pain and Wednesday. Okay, around 7 or 8 o'clock. I will announce soon when exactly will be the time. um, and please don't hesitate if you have any question, either to write in the comment below the recording, or just drop me a message in my WhatsApp. Wish you all the best, especially for the doctors that have their exam coming soon. Keep studying, keep doing the hard work, you will pass. See you all and wish you luck.